Hello everyone, welcome to this presentation. My name is Dr. Tariq Umar and I'm going to present our paper on comparison of occupational safety and health regulation in United States, United Kingdom, Australia, South Africa, and Oman. So the content of my presentation include the introduction and background of our research, in which I will first explain the Omani construction industry and the main causes of fatal injury in construction. This will be followed by the research methodologies, and then the result and discussion section will include different regulation applicable on fall protection, hazard communication, and scaffolding. And at the end, I will outline the conclusion, application, and recommendation of our research. So let us look at to the introduction and background of our research first. The International Labour Organization statistics indicate that the poor occupational safety and health result in an economic burden of 4% of the total world GDP. While occupational safety and health is one of the project and business performance indicator, but in most cases they are ignored. The reason for that is many organizations don't know the consequences of the poor safety performance. There are different ways to improve the safety performance of our organization, and one of them is the effective occupational safety and health regulation and its implementation. There has been a number of studies which basically criticize the occupational safety and health regulatory environment of Oman and suggest that the Omani occupational safety and health regulatory environment need to be examined. Therefore, this paper aims to investigate the gap in the occupational safety and health regulation applicable to both employees and employers in Oman and suggest area for improvement. It's take the Omani occupational safety and health regulation and then compare it to the regulation applicable in the United States, United Kingdom, South Africa, and Australia. So now let's look at to the Omani construction industry. So the official statistic indicate that there are 738,000 residents are working in this industry, but the actual number appears to be more than this figure. Construction projects in Oman are always at peak. Statistics indicate that spending on development project is estimated at 3.12 billion US dollar per year. The statistic also indicate that the value of construction industry in Oman will grow to US$17.88 billion. Likewise, the construction GDP in Oman is forecast to grow to 15.4% of the total GDP. Around 92% of the workers employed in construction industry in Oman are foreigners. In terms of their health insurance, so these workers are basically not insured under the government schemes. Therefore, construction organizations need to do private medical insurance for their workers. Because of the nature of construction industries, the insurance premium for workers in construction is relatively more than those workers in other sectors. So now let us look at the main causes of fatal injuries in construction in UK, United States, Australia, South Africa, and Oman. So in UK, construction industry is one of the worst sectors in terms of fatal injuries. The HSCE statistic indicate that a total of 141 workers were killed at workplace during last year. 38 deaths out of 141 were from construction. Falls from height was one of the main cause of these fatalities in the UK. The top 4 main causes of the fatal accident in the United States include fall from height, struck by object, electrocution, and caught in or between. Construction in Australia is also regarded as third highest number in fatalities. The main causes of fatal accident in Australia include fall from height, vehicle collision, electrocution, being hit by a moving object, and being hit by a falling object, being trapped between or in equipment, and there are some other causes which basically result into 38 deaths. Likewise, Construction Industry Development Board in South Africa recognized fall from height, struck, and striking against as the key causes of accident in construction. Here in this graph, you can see the different causes of work-related injuries in Oman. The statistic in Oman indicate that the major portion of work-related injuries arise from road accident. This is followed by slipping and falling of workers and then getting cramped between solid objects. Now let us look at the research approach used in this research. The research used is mainly qualitative. In the first part, the key organizations responsible for the occupational safety and health in the selected countries were identified. In the second part, the top 10 causes of accident in construction were identified. Statistic from OSHA, HSCE, Safe Work Australia, Construction Industry Development Board in South Africa, and Public Authority for Social Insurance in Oman were used. These organizations were also used to identify the relevant regulation applicable to the top 10 causes of accident in construction. Because there has been many regulation, therefore the final search was limited to the top 3 causes of accident and its regulation. These top 3 causes of accident include fall from height, chemical hazard, and scaffolding. This table mainly gives you the overview of the key regulation applicable to main causes of accidents in the selected countries. In the result and discussion, we will first look at the fall protection regulation. There are detailed regulation for fall protection in United States, United Kingdom, South Africa, and Australia. Therefore, I will directly come to the situation in Oman. So in Oman, the only regulation which look into the fall from height are the regulation of occupational safety and health, which are issued by the Ministry of Manpower in 2008. Surprisingly, a fall from height, or fall from are not used in this regulation at all. But falling are, however, used 11 times at different instances in this regulation. Although it used the term fall several times, but it does not cover the full spectrum of fall protection in detail. Now let us look at the hazard communication regulation. Again, there are detailed regulation for hazard communication applicable in Australia, South Africa, United Kingdom, and Australia. In Oman, they are covered under Article 37 of the Occupational Safety and Health Regulation, which is further supported by 12 sub-articles, but these articles provide just basic information and the overall coverage is quite limited. In terms of scaffolding, again, as you see on the slide, there are detailed regulation applicable in United States, United Kingdom, South Africa, and Australia. But when we review the regulation applicable in Oman, we did not found the term scaffolding at all. In Omani regulation, the word ladder was, however, used at 5 different instances, which obviously cannot substitute the scaffolding. So finally, what we have done in this research, we have looked at the Omani regulation applicable to fall protection, hazard communication, and scaffolding, and then it were compared with the regulation in United States, United Kingdom, Australia, and South Africa. Our result indicate that Omani occupational safety and health regulation is not up to the standard as applied in some advanced country. Therefore, Oman and other GCC countries need to consider the key areas which cause accident and then develop up-to-date regulation for these areas. The top 10 areas which need to be considered in the first stage include fall protection, hazard communication, standard related to chemicals, scaffolding, and respiratory protection, control of hazardous energy, ladder, power industrial truck, training requirement, machinery, and machine guarding, and finally eye and face protection. Okay, here is a list of references. Okay, again, some references used in the research. And finally, thank you very much for your attention. If you have any question, you can get in touch with me through my email address, or you can also get in touch with me through my social media account.